First of all, I just want to express a sincere amount of thanks for joining this morning. It's a very difficult time for everyone, and we know especially in the health and social care sector. So we're really, really grateful for you joining our webinar this morning, and we really hope that this kind of call-in session potentially provides an opportunity for everyone in the sector to get a greater understanding of the challenges that are there, but also the opportunities for hiring that the current situation has brought about. I'm very pleased to say that I've got two fantastic panellists with me this morning, joining me on this call. But before we just go across to both Ursula and to Rob to introduce themselves, just tell you a little bit about myself. So I've got 15 years experience in recruitment. My role at TribePad is to partner with health and social care organisations to support and enhance their recruitment processes through technology. Ursula, would you mind introducing yourself?
Thank you, James. My name is Ursula Jays. I've been working in the recruitment sector for something just over 20 years now. The last 7 years, I have headed up a large internal recruitment function for a national home care provider. And along with the help of an amazing team, we managed to hit annual hire targets in excess of 3,000. So a big operation, but hugely enjoyable. I now am a co-director of Relish, along with my business partner, Kim. We're a traditional recruitment agency, but we do have a consultancy arm that works with clients across the care sector, helping them to bring about efficiencies in their recruitment processes.
Fantastic, thank you, Ursula. I'm also really delighted to say we've got Rob Gready from Eclipse HomeCare who's also joining us this morning. Rob, would you just like to say a few words about your fantastic experience in the sector?
Sure. Good morning, everybody. Rob Grady is my name. I'm the Managing Director of Eclipse HomeCare. We operate across Worcestershire, Herefordshire and South Shropshire. We have 4 registered sites. We're outstanding at one of our sites in terms of CQC. We employ about 250 staff. We operate 2 extra care villages, and we have been at the leading edge of looking at new ways of providing care. We're very proud of our staff teams and have a very strong, long-standing management team. Thanks.
Fantastic, Rob. Thank you for that. So just a bit of information on how we're going to work. It's going to be a 20-minute kind of question and answer with both of our panelists. Please do ask questions throughout using the question and answer tool at the bottom left-hand corner. We'll then take questions from there afterwards. And then once we've done all that, we'll make sure that everyone gets a question and answer sheet following the call. Fantastic. So what I just wanted to start with was a bit of kind of context around what's happening in the marketplace at the moment in terms of the hiring and jobs market. This graph relates from to Monday the 16th of March right through to the morning of March the 23rd, so last week basically. And what we've seen really is an unprecedented number of people applying for new positions. The trends that we've seen are people moving from the hospitality and areas of the retail sector towards logistics, but also in particular towards a very significant and large retailer. So hopefully what this data shows is that this is a real time of opportunity for the health and social care sector to really potentially secure new candidates. And if we also look at some of the data as well that specifically relates to our health and social care providers that use TribePad ATS, and you can see one well-known provider actually had an increase at the start of this week of over 300%. That's a year-on-year increase of 300% in their applications. So what we're going to do now is just go through some questions to our panelists. And as I say, please do add your questions in as we progress through the session and for us to ask at the end of this session. So the first question is to Ursula. What are the biggest changes in hiring that you've kind of witnessed over the last 10 days, would you say?
Okay, thank you, James. Big question. So from what I can see, I think a big change is there is a strong message coming through that the care sector is hiring at high volumes, and it's a sector that can absorb many of those laid off from hospitality, retail and travel, which is great news. Also seeing a less rigid approach, less traditional approach to recruitment, people having to do things very differently, very suddenly. I mean, I can think of an example of a client of ours at Relish who had vacancies for business development managers last week. They don't need to go out there and get business. They have business coming through at high volume. So instead, they flipped the vacancies around and they've offered the 2 business development managers operational roles for the first 6 months. So that shows real creativity out there when hiring. Technology is definitely, I mean, you know, we've got an example of that this morning with ourselves during this webinar. We're seeing tech being used massively, and this doesn't have to be high level expensive tech that needs to be implemented, you know, with vast teams. You know, obviously there's video technology out there, which is coming into its forefront a lot more. It's been around for a while. No one's really taken it up and at great speed, but we're seeing that now. But even simple things such as WhatsApp videoing. A number of people across the sector are regularly now using WhatsApp videos. Everyone has it on their phone. So simple, everyone's got it. And you know, it's helping people make informed recruitment decisions and reducing time to hire. I do think we will see, and I've noticed it myself and colleagues of mine have commented, less candidate movement. Typically at a time of uncertainty, and all the data relates to this during times of recession and economic uncertainty, less candidates will be moving. There will be a fear factor out there. Equally, and I have a couple of examples myself of candidates that have withdrawn themselves from processes over the last 2 weeks, born out of loyalty, staying with their current employers, which is very, very admirable. And I think in the care sector, you'll probably see that more than other sectors, with individuals wanting to stay and support their colleagues, and indeed their service users through this difficult time. But in a really positive way, I think we're seeing a real spirit of togetherness, a real national solidarity. And you know, I read a quote on the internet yesterday from, I can't remember who it was, but it was a famous politician saying that we have never, during peacetime, faced such a fight that we'll fight together. So, but clearly across social media, you know, there are 2 sectors hiring, and that's the big supermarkets and the care sector. So we're going to see some phenomenal behavioural changes across the hiring landscape. It's a massive subject and a big learning curve for us all.
Absolutely. Thank you. Thank you for that, Ursula. Rob, in your opinion and from what you're seeing in your organisation, how is the care sector coping at this time?
Well, clearly, James, it's a really challenging and very fast-moving situation that we're in. And so the first issue is around our staff groups, keeping people on board, making sure that they really do have a good understanding of what's happening. People are understandably, as Ursula said, frightened. They're getting information from many different sources. So for us to help them unpack what's actually happening, giving them regular updates, bite-sized pieces of information as to what's happening in such a fast-moving environment is absolutely key. So we're making sure emails every couple of days, regular voice contact with their team leaders, and we've stepped in at a very early stage ourselves to say we would pay 80% of our staff's normal wages, just to try and give people a sense of us all being together in this. Certainly in terms of customer demand, there is, we think, going to be a tremendous surge in demand, not only from hospital discharge and the like, but actually we think that there are going to be companies who will struggle to cope with their existing workload. We've looked at the sort of business as usual processes and what we can do to improve. We're currently looking at moving very quickly to 7-day working. We've had RAG assessments of all of our clients so that we know if we have large groups of staff go down self-isolating, exactly what steps we can take to mitigate. So we've then written to clients because, of course, not only our staff are concerned frightened and so on, but clients want to know what's happening. So we wrote at an early stage to all of our clients so that they have some understanding of what can be expected of them. And of course, many of our clients would be in the older age group, so they don't have perhaps the access quite to information that many other people in society would have. So talking about social distancing, self-isolating, shielding, those sorts of things. It's all about the people, isn't it? It's all about the people, both our clients and our staff. In terms of hiring and so on, we think there's a tremendous opportunity. We're inducting 3 times as many people next week as we would normally have been inducting. And we're planning to run consecutive weeks of induction if required. We think there's an opportunity. We're currently, possibly going to be able to take on 60 or 100 new staff along the route here. So encouraging people to know that we're with them, we're looking after them, and regularly speaking to them, I guess would be the key points.
Fantastic. Thanks, Rob. I mean, that's really interesting, obviously borne out by the data that we're seeing as well. I mean, just to put some figures on the earlier graph, last year, in the same period last year, we processed 108,000 applications. This year we've processed 816,000 for the same time period. So it really does show us a great opportunity for the care sector, which has been traditionally candidate short, to secure some really new people into the sector. Ursula, has there been immediate positive change for care workers? And what do you, a bit of crystal ball gazing, what lasting change do you hope to see?
Yes, I mean, for myself, and I'm sure we've all witnessed it, there has been quite a dramatic and immediate image change out there. I mean, even as 2 weeks ago, some of us were shocked to see posts on social media describe, even in the national press, care workers being termed as low-skill workers, and that term's being used an awful lot across all the Brexit communications that we've had in the last couple of years. And you use the word immediate. I mean, the immediate change has been people working in the care sector are now seen as national heroes, receiving huge appreciation from all corners of society. I mean, even on Friday, a very quick response from people like McDonald's and Costa Coffee, offering free teas and coffees to anybody in the NHS and healthcare sector. I mean, that was never thought of in our pre-virus lives just 2 weeks ago, when we weren't aware of the big changes ahead. I think now the sector will certainly be seen as an area that provides a stable income, a fulfilling career, a worthwhile job. There's lots of reports coming through about dramatic changes in society's perception already of the care sector. It's all very positive. So that's really, really encouraging to see. And, we've all seen in the press examples of nurses coming out of retirement. And I just read yesterday a lovely story about an MP called Nadine Whittam, who's temporarily left office, and she's returned to her previous job as a carer, working for a care agency in Nottingham. So for the first time ever, those termed as low-skill workers, perhaps in supermarkets in the care sector, are now being seen as the individuals keeping the vital engines of Britain turning. And James, as you reflected earlier, the care sector for years has struggled to fill its vacancies. Okay, it's been a growing sector because of the ageing population, people wanting to be cared for more at home, but the targets that the care sector have had in terms of staffing levels have been extremely hard to fill. And I know in 2019, the average care company in the UK had 75 unfilled vacancies at any one point of last year. Now, I'm not saying that these vacancies are all going to be filled now, because it's going to be increased pressure, as Rob said. There are going to be more people who are going to have to exit the NHS system and be cared for at home. but the care sector now has the opportunity to get some real talent in. And I think, lasting changes perhaps will look to take people into the care sector more so now than ever that don't have previous care experience. Society is changing at a phenomenal rate. So let's use that talent to bring forward and help grow our businesses and make us all stronger.
Fantastic. So the next question is to Rob, and that was quite a wide-ranging one. In 3 minutes, is central government, do you feel central government's kind of doing enough?
Well, of course, they're being really challenged, aren't they, James, by this? It's moved very fast, as I've already said. One of the problems is that there appears to have been sort of several twists along the way in terms of policy and not really thinking about what the implications of those changes are. So that has created some difficulties for us. Specific areas of real difficulty are information around PPE and the supply of PPE. It hasn't really helped for our staff teams to see nurses kitted up as though they were going to Mars, and then being asked to go out and with very little supply of appropriate PPE and no real clear guidance. So that's an ongoing issue as we speak, and you may have heard on the news this morning there's quite a debate about exactly what that should look like in the home care sector. The second issue is around wage assistance and so on. If we are going to have 20–30% of our staff down, the statutory sick pay system is not sufficient. That means we need to put our hands in our pocket. We're in a very tight margin business. We need help with that. The current schemes that have been put in place are not appropriate, and certainly I've approached, at national level through UKHCA and others to try and get that message across. What do I hope for the future? I'd like to just add something about that. And for me, not only do you want to improve the image of our sector, but I want to see there be a change in the way we remunerate staff in this sector. We need to step up as a society and better pay this group of people.
Fantastic. Thank you, Rob. That's great. So what we're going to do now is just to move on to some questions. So if anyone does want to input questions, please do feel free, and I'll pick those out. We'll go through a few of those with the panelists. So questions I've had through: what measures should we take as a sector to cope with an increase in applicants? Ursula, do you want to tackle that one? What measures should we take as a sector to cope with an increase in applicants?
Yes, so I think the problem here is existing resources in care businesses are probably struggling to cope with the volumes. So I think it is about using technology. I think it's about making some immediate changes to recruitment processes. So if any stages can be taken out of the process or speeded up, so it could be, doing online DBSs, asking candidates to send in ID in advance, online training, making sure that people are all signing up to the DBS update service. And I think an example of that you're doing at Eclipse, you're doing online training, you're putting on more training courses. So it's about getting more volume through the system as quick as you can. And, things like 7-day working, we're all working. I'm working from home, James. I think you seem to be at home there as well.
Yeah, I am.
Working from home, making sure that your recruitment teams are equipped to work from home, that they're being looked after, and perhaps changing the hours. So rather than working 9 till 5, and I've seen this with a couple of clients of ours already, getting people to do evenings, Saturdays, Sundays, responding at the times sort of most frequently when people might be going online to apply. So, in summary, speeding things up, using your team resources, And hopefully, with remote working, people are in less meetings, people aren't doing big projects at the moment, but also really reassuring the candidates that are applying to you how you will support them, because people moving jobs at this time, as we've all explained, it is a more delicate time to be changing jobs because it's your income change. And if you're new to care, as that's where a lot of the increase in applicants are coming from, that the data shows, you're going to want reassurance, because all you've got at the moment is what you're seeing in the media. And as Rob said, that is people going into hospitals dressed head to toe in protective equipment that people in the care sector are never going to have access to.
Thank you for that, Ursula. Rob, I think there's one for you here. If people are applying from non-care backgrounds, should our approach to recruiting and onboarding them change from normal?
Well, first to say that more than 50% of our applicants are from non-care backgrounds, and we pride ourselves in being able to target that area and to onboard them and take them through the process. In terms of the onboarding, yes, of course, there needs to be a different approach. There can be a different approach in terms of their induction and training. There can be a different approach in terms of the level of support that they're getting over that first crucial 3-month period, because it's a big change for them. As we've just said, we want to take advantage of more people coming through. So conversely, for those people from a care background, we need to streamline that as much as possible.
I think, Rob, another one for you here, potentially. UK right to work checks, they currently require the candidate has to be present when producing their documents. In your opinion, do you think that the law should be changed on this?
The law does need to be changed. I actually had contact via UK HCA with the Home Office yesterday, just by chance, on this issue. And I understand that they're going to go to a arm's length process now. So, I guess watch this space, but definitely it needs change.
Sure. And another one along similar lines, so maybe you get your thoughts on this. So the room Boris Johnson's trying to reduce regulations in care. We've already seen this in allowing non-DBS check candidates to perform non-regulated care activities.
I'd like to come in on that one as well, James, please.
Okay, yeah, Brill. Is this a risk worth taking to allow care companies to provide more support by bringing carers in more quickly? So get your thoughts quickly and then go to Rob.
Please go ahead, Rob.
Well, so far as we are concerned, we've risk assessed. We've half the size of the induction programs. We use our learning management system that's arm's length. So we're down to 1 day of face-to-face only. Those items where we think it is impossible, other than to bring people together, for instance, moving and handling type issues, we don't think can be suitably done online. But yes, we need to take this opportunity. We can do it whilst being very strict about social distancing. People can think, we thought about whether we would actually hire a village hall if we needed that much space. We're fortunate, we've got quite a big training room here. But think about what the options are to do it and keep the social distance.
Thank you for that. Okay, brilliant. And then another question we've had come through. What can we do to be prepared for the possible high customer demand that we expect due to NHS limitations? Ursula, do you want to say that? Or Rob? Either Rob?
Well, you go for one. It's a really tricky one, isn't it? You'll perhaps be aware, people should be aware, there's a paper on the ethics being published and on the government website, and it's well worth a read, because we are going to be faced with some real dilemmas as to what to do. We need to get people back out of hospitals if this goes the way everybody says it's going to do, and that is going to mean stopping, unless we can increase our staff we're going to need to stop some calls. Now, as I said in my answer to an earlier question, we've told all of our staff that if this really takes off, we will be asking them to reconsider their holiday commitments. They're not going to be able to go anywhere anyway. We're going to ask people whether or not they can do more shifts. So we're going to look at increasing the level of shifts we've got available whilst decreasing work with some existing clients if it really does get to that sort of crisis point.
I mean, I just really echo, yeah, what Rob's saying there. I think it's about being creative, and I think you know, we've all had to, you know, in our own home lives, take on board a lot of new changes. And you know, once you've been doing a job for a long time, you get used to doing it a certain way. I think we just need to flip everything on its head and think about every opportunity to change things. And you know, I would suggest talking to your staff, you know, creating forums and opportunity for people to communicate, because sometimes it's people working on the front line that have the best ideas about bringing in change. You know, we can all sit in our offices doing our operational roles, but I think talking to the carers out there, I mean, you know, I know Rob, talking to some of your managers last week, there's some incredible ideas that come through from people who see, you know, the frontline operations. So I think communication and that will bring creativity through.
Fantastic. Well, unbelievably, our time has reached an end. We're just about to hit past. So I'd just like to say a huge thank you to both Ursula and Rob for joining us this morning. Hopefully it's been really informative. As part of the follow-up to this, we'll send out the questions and some answers to those questions from Rob and Ursula after this call in the next few days. Thank you again for your time. Really, really appreciate it. Please do provide feedback when we do send that information out. We'd love to hear your thoughts, opinions, whether you valued what's happened this morning, and if there are any other topics that you would potentially like us to cover in the future. But once again, thank you very much to Rob and Ursula, and you know, the best of luck to the sector. I know it's obviously a very challenging time. You know, our thoughts, everyone's thoughts are all with the health and social care sector at the moment, and yeah, best of luck to everybody. Thank you very much for joining this morning, and speak to you again soon.